One of the things that the complications with the treatment is that Kenna was on steroids, and her face was like puff up.
Sure.
Okay, how many pounds you gain now from the steroid?
I was up to about 145.
Yeah.
And for her, okay, both of them, the immunity was much down from the chronic illness and all the drugs and the surgeries she was taking. And Christine was having recurrent bronchitis, sinusitis, urinary tract infection. Want to tell them about the urinary tract stricture, urethral strictures that you require surgery?
I've been seeing Dr. Tong now for everything. You know, I go back to see him if I have, if I get a really bad cold, or I think the latest one was the urinary tract infections that I kept getting, and I'm sure women can relate to that because it's not
very
real
common.
painful, but it's just an uncomfortable thing because you have the frequency and the uncomfortableness that goes along with it. So I had a urethral dilation 2 times, and I was still having the burning sensation and the uncomfortableness, so I went to see Dr. Tong for that, and I had 2 treatments, and it was cured. My pain was gone.
Wow. I understand you took your son to see Dr. Tong as well.
Yeah, he was 18 months when I brought Sean to see Dr. Tong because he was having reoccurring ear infections. And most kids do have the
most parents can relate to that.
And that was an ongoing thing, and they were pumping antibiotics into him, and he was on antibiotics for, I believe, like 6 months straight because they weren't, the drainage and the infection was continuing. So I asked him about bringing in Sean, and
He also had surgery.
Yeah, and he had tubes put in his ears too. Before I brought him in, they had put tubes in.
How many treatments did he need?
1.
Wow.
This is Sean McDonald. He's 17 months, and we brought him in to see Dr. Tong today because he's been having lots of colds and a lot of ear infections. So we brought him in, and he's had 3 injections, and he's feeling 100% better now. He's more relaxed, he's laughing, and he was crying and screaming when we brought him in. So there's a different boy here.
With little kids, they pump the antibiotics, and then their immune system drops, and they have a lot of consequences from the antibiotics. So this is just an outstanding treatment because the meds are gone, the narcotics are gone, the pain's gone.
Hello, I'm Will Miller, and welcome to The Other Side. What if you had to give up the job of a lifetime because you had to go on an airplane? Or you couldn't leave your house without washing your hands dozens of times? Or you couldn't leave the house at all? You could be one of the 23 million Americans who suffer from panic disorder.
On The Other Side.
I never felt like a normal person. I couldn't do things like normal people. I never felt happy.
It leaves its victims helpless.
My heart was racing. I broke out in a cold sweat. I didn't want to move. I froze.
It could strike at any time.
You can't do anything, and you're shot out of the saddle.
And if it's never happened to you, you can't believe how bad it can be.
I felt pretty hopeless, so I tried to kill myself.
I'm a prisoner of my own anxiety. Continues.
Welcome back to The Other Side. Can't breathe? Is your heart beating too fast? Feel like you're going to die? Jeff Constant had these feelings every day. You tried everything to deal with your panic disorder, with your anxiety, didn't you?
Yeah, throughout my life I tried vitamins, religion, anything to make me feel better, psychiatrists, and then I used drugs real heavily and ended up in the hospital.
Yeah, nothing worked against that. You got pretty desperate at one point, didn't you?
Yeah, after I tried everything I could think of, I felt pretty hopeless, so I tried to kill myself. And it was when I was recovering from that I saw Dr. Tong on TV, and that gave me hope. And since I've seen him, I don't even think of killing myself anymore.
Yeah, good, great, good. But it's, I thank you for sharing that because, you know, people at home watching, you know, it's not just anxiety. This isn't just feeling a little uptight. This is a desperate feeling, isn't it?
Yeah.
What was your life like when you were struggling with this?
I never felt like a normal person. I couldn't do things like normal people. I never felt happy or anything.
What's your life like now?
It's real good. I can be the person I've always wanted to be.
Yeah. Well, did you see that? He even jumped out and said, "How you doing now?" Real good. His whole face changed. Okay, also with us is Jacqueline Flores. Now, Jacqueline What were you told? Tell us this story. What were you told? How did it affect you?
I was told I had mitral valve prolapse, and the way I understand that is a part of the valve in the heart actually sticks, so that it makes a clicking sound and it makes you feel as if you're having a heart attack, which is not a very pleasant circumstance.
No. And what did it in fact turn out to be?
I was totally despondent. I didn't know what to do. I was having panic attacks, and I was imagining things, and of course one thing led to another.
So this fueled, in other words, this the fear about your heart ailment actually fueled and accelerated the panic
going.
attacks.
Yes, it
How
did.
were you able to be here today?
My son was seeing a doctor and referred me to this doctor, and that's why I'm here today.
Okay. Well, let's meet this doctor. This is Dr. Yi-Wing Tong. Thank you for coming today, doctor. You are a graduate of the University of Southern California Medical School, and you are known for the teaching and the use of Chinese acupuncture. Tell us, how do you combine your Western training and Eastern training?
I got my Western training first, then I got interested in Chinese medicine. Today, what I do is I combine the Eastern concept of the energy flow, which we don't know in the West, but I use anesthetic injections to make it very dramatic, fast, and effective. See, what happens is that the energy blocks cause the circulation to be compromised in the first place, and the organs that are most sensitive to the acute stress are the lung and heart. So already you have marginal circulation, and any additional anger, frustration, further cut off the circulation.
So that's the reason why they often feel like they're having a heart attack, all the stress.
So when the circulation down a little more, the heart and lung are hungry for circulation. So you have hyperventilation and palpitation.
And they're shaking their heads. This describes what the symptoms.
Don't we create a lot of our own problems through fear and stress? And I mean, there's long been known.
Especially in California.
Especially in California. As you pointed out, we're in a lot of stress here because of the economic situation.
Exactly, okay? See, the body, everything you do in the body is orchestrated by the mind. When the mind is not working right, excessive emotion blocks the energy flow.
Dr. Tong is the most wonderful, generous, caring man in the world, along with his staff. My mother, Dorothy, who has very bad arthritis and is an elderly woman, has been in a wheelchair for over 10 years, sits at home, rocks, cries with pain, and all the doctors gave up on her. From the suggestion of some other Dr. Tong's patients, we finally went to go see him to search out other ways. And after just 4 treatments, she does no longer take pain medication. She walks with no pain. She does not sit and cry, and she chases the little 3-year-old around the house.
Stop suffering. Most chronic disorders can be controlled with a combination of Western and Eastern medicine. This unique treatment approach is developed by Dr. Yi-Wing Tong, MD, an anesthesiologist trained at the USC School of Medicine. Yes, arthritis, back pain, allergies, asthma, headaches, TMJ, all can be effectively treated with this method. Many times, the condition can be completely cured. Prescription drugs kill over 100,000 Americans a year and rank as the 4th leading cause of death. And the #1 killer of people under 36 is side effects from drugs and surgery. If you suffer from chronic pain, drugs and surgery are not the answer. Fortunately, the cure is here. At Dr. Tong's Wellness Pain Center, over 90% of patients experience dramatic relief from the very first treatment. Call 888-DR-TONG1, visit our website, or tune into our cable program and find the cure. Freedom from pain programs provide natural alternative treatments to drugs and surgery. Dr. Yi-Wing Tong was trained at the LA County USC Medical Center. He is a member of the American Medical Association, American Academy of Pain Management, American Pain Society, and the Institute of Noetic Sciences. Suffering from a chronic disorder can be devastating. Conventional drugs and surgery never cure a problem. They simply mask the symptoms. The combination of Chinese medicine and Western anesthetic injections can reverse most chronic diseases. If you are suffering from a health condition that nothing seems to help, call Dr. Tong for a free phone consultation. There are better alternatives than drugs or surgery. The remarkable relief from this treatment method is natural, without the side effects of drugs or surgery. Discover the wonderful healing of Chinese herbs under the guidance of experienced herbologists. Most importantly, learn how you can actively participate in maintaining your own health. Dr. Tong's East-West Wellness and Pain Center is located in Costa Mesa at Harbor and Adams. For more information, call 1-888-DR-TONG-1 or 714-556-8664. You can learn more about Dr. Tong's treatments at www.drtong.com.